Hello and welcome to Health in the Heartland, a program dedicated to the health issues that affect you. We are here in the Cancer Care Center of Hardin Memorial Health, and this is actually just recently relocated, and I have with me Ray Poston, who is the Director of the Cancer Care Services here at Hardin Memorial Health. Welcome, Ray.
Good morning.
And tell us a little bit about how this move came about.
Okay. About a year ago, we got a focus group together of our current patients, and we asked them what would they like to see in a center, how could we improve the center we have, and almost all of the patients resoundingly said, get us out of the basement. So we drilled down further, what did they like to see as far as colors and pictures, and we took to heart what they said, and we, over a period of time, created this center. And we've had that focus group back, and it's been an overwhelming success of their feelings. Most of the patients even cried how much they enjoyed this location. So it's been a very fruitful experience for all of us, especially our staff too, to be able to see daylight and see our patients and their experience once they walk through the door. So it's been great.
I think you brought up some great points, Ray, because really cancer care is about personalized care, and really in listening to the patients that we serve, we wanted to make sure that we had cancer care that was quality and personalized close to home. So here we are at 521 Robin Brook Boulevard in Elizabethtown, and offering a lot of different services. Now, aside from just the center itself, we have some unique certifications that I think are very important for us to share with our viewers.
Sure. All of our nurses become certified in medical oncology. They take classes. Even our new nurses that come in have a 6-month orientation period, and then they are challenged to take a test and pass that test. So all of our nurses here are certified in oncology, which is great. A lot of things we have here that we did not have in the basement. We have a resource center that has American Cancer Society brochures and listing of all the programs that are available to our cancer patients. And then we have a free resource room that has wigs in it and turbans and hats for our patients who undergo chemotherapy. And all that material is free for our patients. So it's very exciting to give them things they need that they haven't received in the past.
Ray, on top of that, I think we also have something called the American College of Surgeons Accreditation. Is that correct?
Absolutely. It is a program that we have to submit a lot of data to, and we have to do continuous quality improvement studies. And every 3 years they come back and inspect us, go through all of our paperwork, drill down on all of the procedures that we do here. They talk to the physicians, our surgeons, our pathologists. They go to one of our tumor conferences. So it's a pretty in-depth study, and we have passed that successfully for several years, and we're very proud of that.
Well, Ray, here at 521 Robin Brook Boulevard, we actually serve patients that are oncology patients. Is that correct?
That's correct.
And I know we still have services back at 913 North Dixie. Tell us a little bit about the split.
Okay. We moved medical oncology here because we were growing very rapidly. We have a new doctor, Dr. Adam Lai, and we have another doctor coming in August, along with other medical oncologists that we have here, Dr. Veza. The practice is growing, so we had to make a move also because of that. Unfortunately, we're not able to move radiation oncology out of the basement at this time, but our future plans are to build another building that will bring both of those back together in one location, because it makes it very convenient for our patients that when they come to get a medical oncology treatment and then get radiation oncology at the same time. So our future plans are within 3 to 5 years to have a new building built and bring both of those services back together.
We're really talking about the total care of the patient, and we also have something called the Nurse Navigator, and this Nurse Navigator really works with the cancer care of the patient that's going through the process. Tell us a little bit about the Nurse Navigator.
The Nurse Navigator early on gets reports sent to her of patients who have been recently diagnosed with cancer, and with that she is able to work with a surgeon and whatever other doctor that's involved in that patient's care to help direct them to services they would not know anything about, or help them with rides, help them with medical questions, and actually navigate them through the whole process instead of them being lost a step along the way. They get all the information that they really need. So Nurse Navigator is very important to our cancer patients.
Really partnering with them to help them through the process and get them the resources, make sure they have their questions answered. So we appreciate that explanation of a Nurse Navigator too, Ray. Right, tell us a little bit about, we've been talking about the care of the patient, and we want to make sure they are getting the best quality care that they can. And we have something called the Tumor Conference. Explain what that is.
Okay. Every 2 weeks at the hospital we have a tumor conference, and our surgeons attend that. Our medical oncologists, radiologists, and family practices are invited to that program. And anybody who has a patient who has a recent diagnosis of cancer, if they want to find out the best practice or the best way to treat that patient, they can bring patients to that in a confidential manner, and we can show our x-rays. The surgeons can talk about, is this a surgical case, or is this strictly a radiation case or a medical oncology case? So the patients get the advantage of getting everybody to discuss their case and determine what's the best practice for that patient.
Now, the patient doesn't actually physically come, just the explanation and what would be the best practice as far as taking care of them. So really they're getting a lot of input from a lot of experts in the area.
Right.
I'm here with Dr. Adam Lai, medical oncologist with the Cancer Care Center of Hardin Memorial Health. We're going to talk a little bit about the types of cancers that you actually see here in the Cancer Care Center.
So we see a pretty broad range of cancer. The most common cancers for men are prostate cancer, for women breast cancer, and then also pretty high on the list is colorectal cancer and of course lung cancer. But we see a lot of other cancers as well, melanoma, pancreatic cancer, other upper GI cancers. So we take care of a wide range of cancers here at the center.
Now behind us we look like we're in a special area. What actually is this area that we're in? A treatment area?
It is. So this is our infusion center. This is where patients arrive and get their blood work done. We typically check patients' blood counts and kidney function, liver function, electrolytes, etc. prior to starting treatment, and then we get them hooked up as far as preparation for treatment, IV fluids started, that type of thing. Then we give them anti-nausea medicine, and we're pretty aggressive with preventing nausea. That's one of the questions that I get asked often is, am I going to have a lot of nausea? And I usually tell patients it's going to be a lot better than what they expect or maybe what they've heard of patients in the past. So in the last 10 or 15 years, we've really gotten good at preventing nausea, and specifically chemotherapy-induced nausea. So then after all of that is done, we'll start treatment, and treatment here lasts anywhere from a few minutes for some of our IV iron infusions up to a full day of treatment for some of the more complex chemotherapy that we deliver. But most treatment is done in a single day. Some of them are a couple days, but all of them are where patients come in, get treated, and then they go home. And a lot of times they'll only get treated one day, maybe out of every 14 or 21 days. So that's another question that I get, or maybe another misconception, is that chemotherapy treatment requires someone to be in the hospital or get it for multiple days in a row. That's usually not the case. It's usually just a couple hours or maybe a handful of hours each 3-week cycle, or maybe even once a month. So really treatment is pretty quick in that sense, in that patients come in, get treated, and then go home, and they stay home for multiple weeks.
I think you brought up some great points, because there have been a lot of advancements in the treatment of cancer for patients, and actually the quality of life, and trying to make sure the pain, the nausea that you had hit on, and a lot of those individuals actually are working and going about the best that they can, depending upon, of course, the diagnosis and the staging that they have as far as their cancer. But they're here getting their treatment and then trying to get them back so that they can have the best at that point, right?
That's right. So I have some patients, I even have to reel them in a little bit, because they really try to push themselves. I have one patient recently that took up mountain climbing, mountain hiking during her treatment, and she was a little bit tired after one of these events, and I said, you know, you may just have to
slow down
during treatment, but she's feeling great during treatment. And I have a lot of other patients that continue to work throughout treatment. They may need to take a few days off the couple days after chemotherapy treatment, but everybody's a little bit different, so we handle each patient individually.
Now, some of the individuals that are coming in may have chemo that is what we're calling infusion as far as the IV. Others may actually be taking chemotherapy via a pill formation too. Is that correct?
That's correct, and some patients take a combination. So I have some patients that take a pill once a day or maybe twice a day, and then they'll come in again once every 2 to 3 weeks and get an IV treatment. But I have some patients that never come in for infusions. They take only pills. So again, it just depends on the type of cancer and how we're able to tailor the treatment for the specific patient and also their genetics.
Well, talking about the advancements in cancer treatment, we have something that's exciting that's happened here with the Cancer Care Center. We actually have an affiliation, do we not? Tell us a little bit about that affiliation.
We do, and we're very excited about that. So we are now affiliated with the Markey Cancer Center at the University of Kentucky, and the Markey Cancer Center is the state's only NCI designated cancer center. And what that means is it brings additional resources, meaning dollars and clinical trials, to the centers that are affiliated with Markey. So we're able to utilize all those resources through the Markey Cancer Center and the NCI, which is the big federal government institution, to deliver better care for patients. And many studies suggest that patients that are enrolled in NCI designated centers have a better overall survival. So, and it's for those reasons that we have more resources available for them.
And the NCI actually stands for the National Cancer Institute, and this is huge so that the patients actually have access to maybe participate in a clinical trial and see if that might be the best treatment course for them. Is that correct?
That's correct, and we're also involved in the Baptist Research Network as well for their clinical trials. So we really have a lot to offer patients as far as clinical trials are involved, and we're really ramping that up. So we're getting ready to participate and open some of these trials for the community.
And we're here close to home.
Yeah,
that's it. So you're able to get your treatment and go back to your daily life in your own community.
That's right. And to add to that, one of the things that's been overwhelming from the patients is they really appreciate the new center because it's easy to get to, the parking's easy, they can get in and out easy. We take care of mainly cancer patients here, so it's just a very nice setting for the patient, and they've really responded well to it.
Now, you had mentioned chemotherapy. What other treatments do you do here in the Cancer Care Center?
So we do many other treatments, and we're actually adding more all the time. So I also see patients in clinic. In the other side of the building is my clinic, and that's where I see also anemia. I see patients with iron deficiency, all different types of disorders. I also see patients long-term for follow-up. So cancer patients are living longer, thankfully, but that means they need follow-up after treatment. So we're also seeing those patients as they come in for follow-up. But here on the infusion side, we also do things like IV iron. We give some infusions for diseases like Crohn's disease. We give IVIG for patients if they're immunosuppressed or need those treatments. So there's all kinds of infusions that we can do here for people short-term and long-term, not necessarily just cancer patients.
At the Cancer Care Center, we also have a clinic, and Dr. Lai sees patients. Tell us a little bit about the types of patients that you see here.
So I see all types of patients here, including patients with cancer and patients that don't have cancer. Typically, this is where I'll meet a patient for the first time, unless I happen to meet them in the hospital because they were hospitalized for some reason. But this is where I'll meet patients and their families. We'll talk about their diagnoses. I'll go over any relevant lab work or other workup. We'll go over their imaging if that's relevant to the case. Then we'll talk about treatment, and of course we'll do the physical exam here as well. But this is usually where I see patients the first time and then for follow-up. For my patients that don't have cancer, my iron deficiencies and other patients, this is also where I'll see them. We'll meet, do the physical exam, and then we'll do blood work here in the same facility. There's no reason for them to travel anywhere else, and that's really it. So that's a pretty quick clinic appointment visit that usually takes anywhere from 10 to 60 minutes, depending on how complex the issue is, and then we're able to move from there. Every once in a while, what's nice about our center is if I see a patient and discover something that they need treatment for, well, we can just go right next door to the infusion center if they need blood or fluids or having a lot of nausea or something. You know, we're able to do that right here.
So it sounds like the family can be involved if the patient would like them to too, right? You're able to see the family here in the room and include them as far as the support, which is very important for individuals that are going through cancer and different types of treatments. And then also the testing can be done here, and then also the treatment too, as far as the follow-up with the infusion and blood work or whatever they might need, chemotherapy, etc.
That's right.
Joining me now is Dr. Kevin Sullivan. He's the Director of Pharmacy at Hardin Memorial Health. And we're here in the Cancer Care Center because we actually mix medications over here for our cancer care patients. Tell us a little bit about what's going on behind us, Kevin.
Well, right now Jessica is starting to mix for the morning. We have a very busy morning today. And she is in the negative pressure room, which is, and she's in a particularly special type of hood, which is called a barrier isolator. Chemotherapy is, you know, when you're mixing it, is, I mean, you're dealing with a chemotherapy drug, and so it can, we don't want it to go into the environment. We don't want the pharmacist or the pharmacy tech to be, have chemotherapy on them, so you put it in that type of environment, and so that minimizes, I mean, there's virtually no chance of chemotherapy being exposed out into the environment. So that's a negative pressure room, which means air comes in, so we don't even allow, if anything got out, it could not go into that room and into the other room is a positive pressure room, so we have two IV hoods here, one for our chemo, one for our non-chemo. I believe you had Dr. Lai talk about some of the non-chemo things that are done here, such as IV immune globulin, IV iron, and so things like that. So we do quite a bit of mixing here. This is a state-of-the-art. This is just made. And the rooms up top, they're filtered. There's those grates up there are they're filtered, so bacteria, dust, things like that cannot get into the environment. So these are what would be called clean rooms. So it's very exciting.
Well, and the important thing is actually the chemotherapy treatment is specific to the patient. So it's made here and then actually administered to the patient as far as the treatment, which we had looked at earlier as far as the infusion rooms.
Correct. So we can get things moving as quick as possible, because we don't really want you know, delays. We want the patients, because they can be here sometimes anywhere from 2 to 6, 8 hours getting chemo. So we don't want to have a delay in getting the medication to them. So
the strictest of standards, obviously, because usually an individual that's going through chemotherapy can have a decreased immune system too. So that's a little bit of why everything is so sterile and clean.
Right.
Kevin, you had mentioned very busy getting the chemotherapy ready. Where are we actually with the capacity of taking care of patients that have cancer here at the center?
Well, where we were before at the hospital, we had 12 chemotherapy bays. Here we have expanded to 24 chemotherapy bays. And Dr. Beza, who I've worked with for my 20 years here, and Dr. Lai are keeping us busy, but it's exciting because we have Dr. Amy Braden, who's going to be coming with us. She's coming out of fellowship out of University of Wisconsin. She'll be starting with us this summer. So we're going to be filling these bays up here very quickly, because as we know, cancer is on the rise, and Kentucky is, unfortunately, one of the top places for cancer because of our lifestyle, and so.
That, and I also think people are becoming more aware, hopefully, and then also being diagnosed at an earlier stage than in the past 20 years that we have had too.
Well, and our life, we're living longer.
Absolutely.
I just saw an article this morning that said by 2030, the number of cases of cancer are going to increase 45%. And so you have to have the facilities to be able to absorb that. And a lot of that's because of our age. And so.
Lifestyle habits.
And lifestyle, yes,
right.
Correct.
Absolutely. Well, we appreciate you being here with us to share this information. It's been very enlightening, and hopefully those of you that are watching this, if you have more that you would like to find out about the Cancer Care Center at Hardin Memorial Health, we invite you to go to www.hmh.net and click on Cancer Care. Thank you for joining us, and tune in next month for another important edition of Health in the Heartland.